It's very interesting how chiropractors end up being chiropractors. Let me tell you my own personal story. When I was a teenager in high school, I used to play a lot of tennis for the high school team and a lot of football as well for the high school team. I used to get banged around a lot. My mom used to take me to the chiropractor. At the time, I didn't think much of it. They used to help, but out of sight, out of mind. When I was okay, I didn't go to the chiropractor. Well, then I moved on to college. Now, when I went to college, I wanted to be a medical doctor. That was my dream, help people. And I went through my 4 years of college, if you will. I double majored in sciences. And then I was going to head off to medical school. Well, right at the transition period between college and medical school, I got into a big car accident. Now, the head of the medical school tells me, maybe you want to go see a chiropractor. Well, I didn't think much of it. I knew chiropractors, but out of sight, out of mind, I didn't think much of it. Well, this car accident ended up basically ruining my life. I was very athletic, I was very active. I used to run 5 miles a day, and here I was, weeks would go by, and I just couldn't run, couldn't do anything without having severe debilitating pain. I had a severe whiplash to my head and neck area because in the car accident I almost went through the windshield, so it was debilitating. So one day I decided to follow the advice of this medical doctor, and I opened up the Yellow Pages. Yes, back in those days, this is a little bit pre-internet, so I opened up the Yellow Pages and I find the biggest chiropractic ad I could find, okay? And the thought was, if he's got the biggest ad, he's got to be the best. So I end up calling this chiropractor's office, and we set up an appointment, and he does a thorough exam, and he says to me that he's finding problems that might have been missed under my medical exam, and specifically he finds this upper cervical problem to the atlas. This gentleman was an upper cervical specific chiropractor, and so we get done through exams and x-rays, and we start some treatments, and within a week or two I started feeling better. Now, I wasn't cured in a week or two, but I started feeling much better. Now, what was interesting, to me at least, is sometimes this gentleman would run late, and I would wait in his waiting room along with other patients. And I think I learned more listening to these other patients tell their stories. I had one lady tell me that she had her migraines helped and basically fixed by this gentleman. I had another lady tell me that she had severe digestive problems, Crohn's disease, which is debilitating for most, and Crohn's disease disappeared under this gentleman's care. So I was just simply amazed. I had another particular patient who told me that her foot problem, she had plantar fasciitis, that got helped by this chiropractor. Now, I didn't know what feet had anything to do with spine, but he was helping all kinds of things, and it intrigued me to the point where, while I entered medical school, I became disinterested with the model, if you will, the allopathic model of, if you have a symptom, try to cover it with either a pain medication or a surgical intervention. So I became less and less interested in that model and more interested in the holistic chiropractic, vitalistic, if you will, model. So I ended up making a drastic change, and I quit medical school, and I ended up going to chiropractic school in Atlanta, Georgia. And as I said, it was a very drastic change, and I was optimistic about it though. And I did my 4 years of chiropractic school. I did my 2 years of postgraduate work and studies in the upper cervical specific work, and it was just amazing. Now, while I was still in school, in the chiropractic school, you have to do a certain amount of treatments on real people, real patients, in order to graduate. Well, one of those particular patients happened to be a young boy. He was an 8-year-old boy that came to the clinic. I'll give you a little bit of background about his story. He had consistent migraines, he had digestive problems, and he had personality disorders. Now, what was interesting about his birth was he was actually born a cocaine-addicted baby. This particular little boy was adopted, and his adopted parents took him in to see if chiropractic could somehow help. She had heard stories about potentially helping, and I had 2 weeks to work with this young boy, and it was amazing. Nothing short of a miracle. His migraines stopped, his digestive issues and the vomiting were helped, his personality and his moods were improved, and even though they were from out of town and visiting, I kept up with them, and following from the months, the little boy's life was just ultimately changed by chiropractic, if you will. One other story that I have while I was in chiropractic school was this. There's a gentleman that came in, and unbeknownst to us, he had a very severe condition, lower back problems with discs that were herniated in his lower spine. and he had been to all sorts of medical doctors. He had been to the Cleveland Clinic, all sorts of specialists in the lower back. They had recommended lower back surgery, but he didn't want to go that route. Now, because of this severe workman's comp injury, he was out of work for 2 years. He was so depressed with all the pain and the pain killers, if you will, the medications that would alter his mood. He became depressed and his wife left him. He was out of work for 2 years, depressed. His wife had enough, couldn't take it anymore, so she leaves with the 2 kids. Now, when this gentleman came into my office, we didn't know all this, but we did a treatment. And after that one treatment, he comes in about a week later and basically says to us, sorry, I'm getting a little choked up. He says to us that that night he was going home to kill himself. He had a gun on the nightstand, and we were his last hope. These chiropractic college students, we weren't even real doctors yet. And he was so amazed that he could actually sleep. He had insomnia. This gentleman had, because of his severe pain, he used to have to sleep about 30 to 45 minutes with his back up against the wall. And after a certain amount of time, he would change and he would sit in a lazy boy. And after another certain amount of time, he would go in his bed and sleep for 30, 40 minutes. And as you can imagine, always doing this, he had severe insomnia. So that night, after the first treatment, he actually said he slept 12 hours straight. He had not slept that many hours in years. So he had a lot of hope, and he actually did very well, and he actually, we fixed him. We got rid of his back pain, and he went back to work, and his wife, actually, they got remarried. If my story touched you, ask your chiropractor. Ask somebody else in the waiting room. Maybe chiropractic changed their life too.